welcome you all and thank you for attending the press conference. My name is Keven. I'm a cardiologist. I served at South County Hospital for 37 years and recently retired. And it's a long story as to why I'm here, but I'm glad that I am, and I'm glad that you're here. And I want to introduce my partner here, Dr. John O'Leary.
Like Steve, I started in '85, and I've been here for about the same length of time. My children are
Speak right into it.
My children are all born at South County Hospital. My grandchildren were born at South County Hospital. I was a patient with, as a pediatric patient with Dr. Roger Ashley, some you may know, and Bill McDermott. And I was hospitalized at age 5 with pneumonia. So, the ties don't get much tighter. And, we know basically everybody in this room, fortunately. And we're here for you. We're not doing this for ourselves. We're not doing this for ourselves, we're doing it for our community. Speak up. Thank you. You got it? Okay, Doctor?
We can't hear you.
Okay. Very good. Steve, you want to start?
Okay, you've already heard from physicians regarding our grave concerns about the leadership issues at South County Hospital. Today, we are here to provide patients, the most important stakeholders in this whole process, the opportunity to speak about how management is significantly impacting their health issues and why they feel that executive management must be replaced to preserve the quality of healthcare at South County Hospital. And you'll hear them say that they feel they were calling upon the governor and the attorney general to step in and help our community hospital. It's a wonderful institution. I've had a long-standing history with this in building up the cardiac program here, and we don't want to see this go away. So I'll introduce the 3 individuals who are going to tell their story. Christine Saravo, Jarednson, and Pam Madison will come up and speak. And I'll let Dr. O'Leary introduce the first speaker.
Christine has been a longtime friend. I met her when she was 10 years old through her brother, and she is quite a character, as she still is.
Thank you.
You're welcome. Christine is a longtime vital member of our community. She, in the past, has received exceptional care at South County Hospital Cancer Center, which is now in a bad situation, as you may know. So, Christine, without further ado, come on up, say hello.
You can hold it. My name is Christine Patrick Saravo. As Dr. O'Leary said, I grew up in South County. My parents and my siblings use the hospital often, and we were very familiar with the doctors and the staff. I did my internship at South County Hospital, and both my children, Tom and Leah, were born at the hospital. During COVID, I was diagnosed with stage 3 cancer. As Dr. O'Leary stated, it started as a lump, and then everything from there was a blur. In lightning speed, I had a team of doctors working together to ensure my well-being and the best possible outcome for me. Dr. O'Leary introduced me to Dr. Angela Tabor, who is a chief of oncology services. She immediately made me feel at ease. I fondly remember the first day we met, she took the time to walk me down to the OR and stayed with me to answer my questions and reassure me before my procedure. Everything happened so quickly, and I can honestly say my husband, family, and I were terrified of what to expect as we navigated the unknown. Many people asked, why didn't I go to Boston? Their response was easy. This is my hospital, and it has been for 55 years. The doctors and I know each other and my family, and I trust them. I will be a priority. We're in a bigger hospital. I'm just another patient. As you might remember, during COVID, no one could accompany you for treatments. Very quickly, the oncology department became my extended family. I look back on those times and I'm amazed how above and beyond the oncology department went every step of the way. They sat with me, they reassured me, and they held my hand. I had their personal phone numbers, knowing it would be okay to call them if I needed anything at all. It was an extremely scary time, and I could not have felt more reassured and comforted by them. The communication between my doctors was excellent and timely. The continuity of care was above and beyond what I could have expected at any hospital setting especially the hospital in my backyard that I am so passionate about. To hear that this wonderful oncology team has resigned and other crucial doctors are leaving is heartbreaking. I still consider all the staff, and especially Dr. Angela Tabor, not only true heroes, but more importantly, friends. Recently, a friend of mine who has been diagnosed with cancer asked me for a recommendation. I was sad to say, don't go to South County Hospital. I have no idea who will be there for you in the oncology department or whether there will be any continuity of care. The doctors are all leaving, and it's an uncertain, worrisome time. It's very unsettling to not know what direction the hospital is taking, and there seems to be a terrible failure of leadership. Go elsewhere for care, was my response. I have to ask, what happened to the mission statement of the hospital, which I quote, is to be your most trusted health partner. And it also says to earn your faith in us by delivering the exceptional experience that you deserve, unquote. What happened to the vision statement, which again I quote, being a model health system, advancing high value health and wellness for our communities by delivering unparalleled quality service and innovation, unquote. The current CEO, CMO, and the chairperson of the Board of Trustees are failing miserable with these statements. The only feasible solution is to replace these people as soon as possible and take back our remarkable community hospital. If we act quickly, perhaps we can retain and possibly regain some of the incredible doctors that make South County Hospital so special. We are calling on the governor and the attorney general to help us save our hospital before it's too late. Thank you.
That was wonderful. Next, I would like to bring up our second speaker, Jarednson. Mr. Robinson is a cardiac patient who's in our practice who sustained myocardial infarction and ended up in the cardiac rehab program and then in the maintenance program, for which he spent a considerable period of time. And he'll tell you about his feelings about what the cardiac rehab program meant to him and his attempts to save the program, which was cut a few years back, perhaps because it wasn't making enough money.
My name is Jarednson, not Robinson. I don't want to be associated with the president of the hospital. I am a resident of South Kingston. In 2012, 2013, I had a heart attack. And I had several operations, but the best part of it was when I went to the rehab gym after. Oh, okay. Okay. Can you hear me in the back?
Yeah, much better.
So after my normal 3-month period of rehab, I decided to stay on because there was an excellent staff at the gym there. Then, after 9 years of going there, Mr. Robinson, I always want to try to say doctor because I'm surrounded by him. Mr. Robinson decided he was going to take the gym and make it into offices. Because of that, in the 8 o'clock class that I was associated with, I decided to develop a petition. All 15 members of that class signed the petition. When I called Mr. Robinson, to ask his secretary if I could have 15 minutes just to say that our concern about losing the gym, something that we had been part of for so long, she told me, someone will get back to you. That someone never called. I never had the opportunity to present the petition or to let my feelings and those of the other 15 people know. Because of that, I had also been a donor to the hospital for 8 years. That stopped. And unfortunately now, I'm involved with Blue Cross Blue Shield with their gym over here in Narragansett. But I'm just hoping, it's wonderful to see all you people and to support, but I just hope that whether it's the governor, the attorney general, whomever, can do something to make this hospital what it was a terrific institution. Thank you.
Parenthetically, cardiology physicians, cardiology department, so to speak, had no input into this decision. We were told about it after it was finalized, and we never got 15 minutes with Mr. Robinson either to impress upon them how important this was for the patients, both physically, psychologically, and from a medical standpoint. These patients did very well and kept out of the emergency room, kept out of the office because of cardiac rehab. So it really was a major part of my therapeutic offerings that cardiac rehab existed. The third person is another cancer survivor. Her name is Pam Madison. She's a pharmacist, a South County resident, and served as co-chair of the Cancer Care Advisory Council. And she had a video that has been placed on the heart hospital website at one time, and things are very different now, as I'm sure she will tell you.
Yes, please. Yes. I talk with my hands, so please, please hold it. Okay, thank you all for coming today. I feel so blessed to have an opportunity to tell you how wonderful this hospital was to me, and to hope that you can hear our concerns so it can once be wonderful again. I was diagnosed with cancer in 2014 at South County Hospital. And as Dr. Ferris said, I've lived in South Kingstown for 40 years. I was a pharmacist for over 3 decades. I understand healthcare. I never thought I would be the patient instead of the provider. But this hospital wrapped their arms around me. Sue Hall was the nurse navigator. She immediately called me. She made sure I came in for all my exams. I might not be here today. I'm alive here today, speaking to you because of the care that I got. And I was concerned about staying in a small hospital, just as Christine said. People said, go to big places. They're better. But I didn't want to have to travel far from home. And when I walked in that hospital, I felt loved. And I was not, like she said, a number. I was a person. I was a neighbor. And everyone in the hospital seemed happy to be there. Everyone in the hospital treated each other with respect. I don't care if it was a surgeon or a housekeeper. People were kind to each other. And I got an opportunity through Sue, who meet everyone. I met the pharmacy oncologist, I don't know if they have one anymore, nurse navigators, not sure if they're there. I got to go to the infusion center, meet the nurses, the infusion nurses, the radiology oncologist. And after I spoke with every one of them, I knew I felt safe. I felt like this was the right place to go. And when you have cancer, it's very scary. They're pumping poisons in you, they're irradiating you. You don't have time to worry about if your doctors know what they're doing or if you don't understand your treatment. And there's no way an oncologist can give you the information you need in 10 or 15 minutes. My first meeting was an hour and a half. Family wants to understand what's going on. Questions come up during treatments. Every human being is different. You can have a carpenter building a bench, and if that carpenter doesn't show up tomorrow and you bring in a new carpenter, the bench will come out fine. The bench doesn't care. But we're human beings, and we need to be understood. And everyone wants something different. And if things turn bad, I want an oncologist that knows that they can tell me, maybe it's time for hospice, or maybe we should bring your family in, or notice that I'm not feeling well, because sometimes you might say you're fine. But when you have the same infusion nurse every single time, she recognizes there's a problem. I went through that care, and I'm happy to say I'm here. It was 2 surgeries, a year of chemotherapy, 6 weeks of daily radiation that I could drive to myself. And because you have limited energy when you're sick with cancer, you don't have times to commute. If I had to go all the way up to Providence or to Boston, so much of my life would have been involved in travel, I wouldn't have been able to spend time with my family. So because of that care, as Dr. Ferrer said, I made a testimonial video, which is currently on the hospital website, telling people to come here, telling them to trust the hospital. It's still up there, and I know that no one will get the care that I got. I also was able to join the Cancer Advisory Council. This was a group of volunteers. Everyone showed up. We had nurses and people who worked all day in that hospital who gave of their time freely, missed their dinner with their families, to sit down and tell us what was going on, ask us what we needed. We could offer our help. We free help, volunteers. Every month we were there, and we had so many great projects and programs, and that's gone. Patient Advisory Council, that's gone. All different kinds of free things were provided to cancer patients. That's gone. So the other thing I wanted to say is we keep hearing from administration, it's money, 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 money. Well, I'm sure there's money, but I'm in healthcare, and we've been complaining about money for decades. So that's not the only issue. And I'll tell you what doesn't cost money. Treating providers with respect, showing people that you appreciate what they do. We had a cancer survivors event every single year in June. And all people came, volunteers, and we could tell our stories. We could tell the providers what it meant to us. Patients going through treatment could see other patients that made it. And I understand this year we didn't have it because the new cafe was going in. I'm sure that cost money. I didn't come to South County Hospital because of logos and fancy things. I came because the care was extraordinary. The people made a difference. And when I was there, we didn't have that beautiful cancer center, and it still worked fine. So I am imploring everyone, please help us. Governor McKee, Attorney General Nerona, listen to the people here. Every community needs a hospital. We need schools, we need a library, but everyone gets sick, everyone dies, and everyone has family. And without a community hospital, what is a community? So please, please help us. Help us resolve this problem. It's crisis right now, and the fact that we don't have all those cancer providers there breaks my heart. These people would not have left unless they did everything they could. And I know that leaving their patients was probably the hardest decision they ever had to make. And if that isn't a cry for help, I don't know what is. So I want to say I'm standing here today to support them, because when I was broken, as they are now, they supported me. So please help us.
I would like to invite questions from the media to the speakers.
Hello. Has there been a vote of no confidence in current management, or will there be? And what is your relationship with the board? I've been covering news for a long time. You don't see this very often, this type from senior staff, professional staff, this type of public outcry.
Yeah, I actually meant questions to those speakers, but,
but
I will entertain this question. You know, there has not been a vote of no confidence by the medical staff as of now. Microphone. There has not been a vote of no confidence on the part of the medical staff. Complicating life nowadays is that most of the medical staff that's still here is an employee. And if the vote goes awry, if the word gets out that people were voting no confidence, they fear for their job. So I don't know if that will happen or when. Because of lack of transparency, we don't really know what the board is thinking. We have very little opportunity to communicate directly with the board, and I honestly don't know where the board is at with this. They have had a lot of opportunity to learn about this, but it seems like it's fallen on deaf ears.
My personal experience is this. Back in April, when this began in April, and it started with a letter that I crafted to my colleagues, bringing up all these issues. What's happened to the cleanliness of the hospital? What's happened to cardiology going to Care New England? Why is oncology resigning? So it was a very nice letter. It was not a difficult letter, but it got placed on the desk of Aaron Robinson and also Keven Charpentier. I got a call from Keven Charpentier asking me to join the team, meaning squelch O'Leary, which was very obvious. So within a week later, if they didn't join the team, I got a letter from the hospital's legal counsel threatening me with defamation, and they threatened to sue me because I published a letter bringing up factual points. So if the points are factual, that's not defamation. So I shared this with my attorney, and he said, this is not worth the paper it's written on. This is total garbage. They're trying to threaten you, but also the other message was, I think O'Leary's going to send this to other doctors and scare them away. So I asked to speak to Robinson, never returned my phone call. From that point, fortunately, I was working behind the scenes slowly. I couldn't get doctors or staff to join me or be on the record. So if you don't have people on the record, as you know as reporters, it doesn't exist. So Dr. Farrer, fortunately, this got really large really quick. He joined me and he's helped me beyond my ability to express. So that's what's happened and evolved. In fact, the Boston Globe introduced Dr. Farrer and I a few days ago. It was a 2-hour interview, and they said, you know, of all communities, they never expected this would be happening in this very affluent, educated community. In fact, they were in disbelief until we revealed the letters, the defamation letter from the attorney, and other difficult things were said, and we were put in a difficult spot.
Are there any questions for our patient speakers? Yes.
In the immediate future, what's the first thing that they'd like to see happen?
Repeat the
question. Repeat the question.
Yeah, the question is, in the immediate future, in the immediate, at this time, what would you guys like to see happen?
I'd like the community to have a voice. I think the leadership has to go. That's my personal feeling. I would like to make sure that we can try to all work together to figure out financially and whatever we can do to keep this excellent hospital here. And I don't think it's going to be possible with the current administration. It's a team thing. Healthcare is a team thing. Everyone works together. That's how it is. And from the administration down to the lower level, everyone has to be able to talk. And we need transparency. And those things are not happening there. So without a collaborative thing and everyone putting the patients, I mean, that's why they're here. You know, the patients are the ones that everyone should be thinking of. And that was the case until very recently, I'd say the last 5 years. That's when everything started to change. So I would like to have an open dialogue, and I think we need new leadership. I don't know.
Thank you. Christine, do you or Jared want to add to that?
Pretty much new leadership. Something, sayonara, Mr. Robbins. Like the song goes.
Yes.
I apologize, my questions are going to be largely directed at that senior staff here. Can you tell us anecdotally, perhaps, how many community hospitals are left in Rhode Island that are independent?
If I'm not mistaken, we may be the only one. Is there another independent?
No.
And I'm sure you communicate your concerns, both professionally and on professional issues. Nationwide, these seem to be disappearing. What, as a professional who works in one, what impact has that had on community care, the disappearance, if you will, of community hospitals?
I think it would be devastating for this community if they lost their hospital. You've heard the speakers. You know, no one wants to go north of the tower in South County if you're familiar with the culture here. And I have elderly patients who just cannot drive on 95. They can't get to other hospitals. I mean, the nearest hospital is not very close. It's westerly to the west in Newport, over 2 bridges, and the other hospitals are really a very long distance away from them. So I think that the future, the survival of this community hospital, whether we stay independent or whether we're acquired by a larger entity like Westerly needed to do with Yale to survive, I think it's imperative that we survive.
we know for a fact that Mr. Robinson approached Lifespan looking for an alliance and possibly Care New England. And they basically said they wanted nothing to do with our facility, and mainly it's because of him. So our partnership has been blocked by the senior administration. And they said they'd be more apt to speak to us if things were different.
And one last follow-up. If you can speak to viewers who might not be familiar with your hospital, those of us who live all the way up in the north, in the Blackstone Valley, what other community services, say for example, ER services, maternity, do you actually still offer? And are those as troubled as you portrayed cardiac care and to be?
Well, they still have cardiology because although we work now, my group works for Care New England, the deal was that we would stay at South County physically, we would provide services to the hospital. So otherwise we would have left, all of the cardiologists would have left. The nephrologists are very much on the brink of leaving. I think what keeps them here, what they've told me, is that their patients have no other alternatives for local nephrology care. OBGYN is in disarray. They're a very unhappy lot. I'm not sure how long they'll survive. This week, I learned two more primary care doctors, I think maybe 2 out of 3 at the Westerly office have tendered their resignations. And there's no one in the Woodruff office, which is up the street, that's still there, as far as physicians concerned. So it's hard to find and replace physicians. But this administration is very poor at retaining. His interaction has been abrasive, demeaning, and you're not working hard enough, you're not seeing enough patients, you're not generating enough money, and that puts providers who want to deliver high quality care in a very precarious situation. They took a Hippocratic oath, and corporate America in some cases is asking them to violate that. So we still have a very robust hospital that provides high quality care at the moment, maybe with some exceptions, but we lost our radiation oncologist, and someone's working part-time. Losing the oncology department, which is going to be replaced by locum tenens that have only committed for 1 year. We have a cardiac cath lab. We have a pretty full, well-staffed emergency room. We have the orthopedic guys who are doing a lot of cases. But a lot of the orthopedic volume has decreased because they have a surgery center up the street in Warwick. And so a lot of the cases are being done as an outpatient. That's obviously hurt the bottom line. And if you don't have other services to fall back on, we've lost the sleep lab because we're told it's not productive, it doesn't make any money. Lactation service is gone, which is vital to women who are struggling to breastfeed their baby and need a lot of hand holding. So a lot of the services have disappeared, but we still have very dedicated nurses, doctors. They're not going to do a bad job no matter what happens, but what they do is they leave. So the care is not going to deteriorate on an individual healthcare provider level because that's not who we are. It's in our DNA to provide good care, but that's going to go away when all of these dedicated employees who've been here a long time, 20 years, are suddenly leaving.
One thing that Dr. Ferrer didn't mention, and this is from an internal medicine point of view as primary care, even though cardiology has a presence here in South County, it's not like it was, because in order to get a cardiac echo or a nuclear scan, it's booked out months and months down the road, and that is not sufficient or safe. So I'm sending all my cardiology now to Yale New Haven, where they can do a heart echo in 2 weeks, a nuclear scan in 3 weeks. So all those patients and the money that follows those patients is leaving the system. My oncology will soon leave. My pulmonary medicine now, because there's only one pulmonologist in the community, she's booking 9 months out. All my lung and pulmonary goes to Yale New Haven now. Again, the money follows the patient. That means revenue is going to drop. Last year we had a $6 million loss at South County. He's projecting $3 million. I'm going to tell you it's going to be $12 million. Donor support is down tremendously now with this information. I've talked to my wealthy donor folks, and they said they're now sending money to the Johnny Cake Center, which is a center for basically indigent youth to help them with school and other technical learning. So a lot of services are leaving, and that means that's just a recipe for collapse. That's what's going to happen.
Have you had any support or outreach either from the municipal government or the state legislature?
Not yet.
Not so much a question for our lovely speakers, but feel free to jump in if you have any thoughts. Do you guys see a parallel with Stewart Healthcare over the border in Massachusetts with this?
Question is, do we see a parallel with Stewart Healthcare? Not really. I mean, they're a very large system, and it appears that mismanagement may have occurred on a very wide scale, and not we're in the minor leagues compared to them. But obviously, a lot of the hospitals were threatened. A lot of them had closed or might close or needed to be bought out to not close. We only have one hospital to fall back on. We don't have 30 hospitals like Stewart, and we don't have another hospital in this area. But again, we're independent. We may not be able to stay independent, but we don't want to lose the hospital. This is the only real option for patients who live in this area. And we have patients from Warwick to Westerly. So, the hospital's had a good reputation for a long time, and people come here from, they'll drive past Kent to come here, or drive from Westerly to come here. So that's going to change. We already know that donors are telling us that they can't support the hospital under the current administration anymore. They're finding other sources for their philanthropy, and I think this is quite sad.
Another barometer of this problem is all over Rhode Island and nationwide is a tremendous shortage of primary care physicians. In fact, the University of Rhode Island is considering opening a med school. That's years down the road. But my own experience is I had a very large practice. I retired in 2020 when COVID hit. We would normally get 100 phone calls a day, but during COVID it was 300, and nobody had answers. Where do we get tested? The state government didn't, our IDOH didn't know. So as I retired, I had 200 people that joined a very small practice with me. I kept it at 200. They're paying me annually a large sum of money to retain me. And what I do with that is I have a cell phone 24/7 with my secretary. I've got a leather bag, like Dr. Mucus Welby. I mean Marcus, is that Marcus? Yeah. And I make house calls. I've been out late at night. I've had people at home on hospice where they died with my hand holding their hand. So this is what it's I have a waiting list of 50 patients, which I'll probably never activate because I'm at 200 and there's an outcry for primary care. And I find it's just horrible. I never thought I would do this.
Either of you can answer this. I think it would be the obvious answer to some of the problems might be, well, look, there is a primary care shortage so the answer to some of these concerns that you've raised might be from administrators. Well, of course, there's a primary care shortage and we're suffering from that here like everywhere else, and these problems are systemic. What do you say to that?
My response to that is that's true. However, it's manifested many-fold. It's much worse here because of our CEO. The chief medical officer, Mr. Charpentier, Keven Charpentier, is an arrogant, divisive, vindictive person who treats doctors like you probably treat, a rabid dog. So what's happened is it's much worse because the admin here doesn't collaborate with us. They divide us. That's why it's worse. If we had a CEO that we could talk to and feel good about, for example, we had a CEO a long time ago, Donald Ford. Every day he'd walk the hallways. He walked into the laboratory. He walked up, he'd say to the ER doc, hey, how you doing? What, can I get you a coffee? Nobody knows Robinson goes to the floor, nobody knows who he is. They have no idea who this man is.
Is the Rhode Island Department of Health expressed any concern?
We had sent out a letter, and the letter has been acknowledged by the director, Dr. Jerome Larkin. We haven't received more than acknowledgement that they received the letter thus far. To add to Dr. O'Leary, if some of you, I think you drove from Cumberland.
Yes.
So I told you you wouldn't see a lot of homeless here. We have a pretty affluent community, which means we have a pretty good payer mix. Most people have insurance, or at least Medicare. So we're in a unique position to be successful. And, you know, the area is beautiful. We have beaches, we have boating, we have... So if you're going to be a primary care physician, where in Rhode Island would you want to practice? You know, this is a natural magnet for people. And yet, and it always has been, and that's why people came here. So if anybody is positioned to attract primary care, we should be. And we had primary care, and they would have stayed. And they left to go elsewhere in the state, not out of state. But they were driven away by the administration. So it's hard to recoup that. But, you know, we shouldn't suffer to the same extent for all those reasons as other places in the state. So to say primary care is shortage, it's not our problem. You know, I didn't cause it, I'm not contributing to it, to me just doesn't hold much muscle.
What
Yes.
is it that you're asking from the governor and the AG? Patients spoke, you guys spoke, that you want their help. What exactly do you want them to do? What does that look like?
Whatever they can do. If they can help replace executive management, that would be fine. I don't know who else to turn to. I think that you know, we've had these sessions. The community is very much on board. Many of all the doctors that have shared their thoughts with us are on board. The Board of Trustees may not be on board. I don't know. And if they can somehow bring them around to understand the situation. I don't know if they have a knowledge deficit or why they have let this go on for so long, but I know that Chairman of the Board, Joe Matthews, has been fully aligned and supportive of Robinson. So he is part of the problem too, if he can't understand that some of the actions Robinson has taken or has been directed to take are undermining the quality of healthcare at the hospital and may lead to our demise. So out of desperation, we want to appeal to Governor McKee and Attorney General Nerona, because we don't know where else to turn.
Just one more statement for me. Also on the Board of Trustees is a gastroenterologist, and he seems to be fully aligned with Joe Matthews, the chair. Now, he's the chief of the medical staff, meaning he meets with the medical staff on a regular basis. Now, he should be asking for a vote of no confidence. But if he is complicit with the top floor, the administrative floor, and he's complicit with the chairman, that vote of no confidence, which we've done before with the prior CEO who was not effective, that person got a vote of no confidence and he was dismissed. But because the doctor I'm speaking about is really, we think, in the pocket of Matthews and Robinson, I don't think this will come to the medical staff, which is a tragedy.
And this chief of the medical staff his term's about to expire. And the president-elect of the medical staff has said, I am not going to become president. I cannot work under this administration. So he recently announced that he will not ascend to the president of the medical staff. So he's resigned from that. I think there was a question there.
Yeah. As a concerned member of the community, and I'm sure everyone in this room is extremely concerned about the loss of a community hospital, what's our next step in terms of, as a community, what can we do in terms of contacting either the chairman of the board, the administration, the government? We need to take action as a group. Otherwise, we can all walk out of this room today and nothing will happen. So what can we do to support you? Do we have a list going in terms of email lists? What can we do? I guess that's my concern, is that we lose momentum here today.
Lori Kelly has been sort of our, I will say.
We're all just helping out and trying to do what we can. You will notice that, you know, this library was built with a Save Our Library signs. We're going to be doing Save Our Hospital signs. Change.org, that's the QR code up there. If you haven't signed it already, there's a petition, which is just piling on to the excellent letter that was published by these doctors about incidents that happened. If you agree and you sign it, I mean, we get several thousand people. We just hope that people will then, the Board of Trustees will notice it's a groundswell and will meet, you know, face to face. And yes, the objective is to get rid of the current administration, but not even listening to the medical professionals. I can't believe that that's going on. So there's probably going to be more meetings. I'll have a piece of paper to take down emails and stuff. So because everyone brainstorming together next steps is going to be more powerful than, like you said, just wandering out and hoping that somebody's got it under control. So any ideas you have, people have said newspaper advertisements, people have said publicists, because how you market yourself is so important.
Also there are several people in the room who have written op-eds in the Narragansett Times. That's really valuable. So, you're all welcome to do that. And that's powerful because that keeps this ball rolling. And if that doesn't continue, and like you said, if everything dies when we leave the room, we've not reached our goal or objectives.
At the end of the day, only the Board of Trustees can remove executive management. So I would implore you to write individual letters to all of the board members expressing your sentiments about this issue and how important it is for the leadership to change. They're the ones that need to have the vote of no confidence. The medical staff can do that, but we haven't had a voice since this CEO came in, and I'm not sure the board would listen to us, but they have the power to make change, and those are the people that have direct our efforts. I think that the petition that Laurie done is wonderful and is growing by leaps and bounds in terms of names, but ultimately we need to co-opt the Board of Trustees to act.
Relying on normal corporation structure, the administration of any corporation is appointed, named Wheaton Vaughn. I'm a retired banker for 35 years. Where was I? Yes. Normally, a corporation administration is appointed by the board of directors. The directors, in turn, are appointed by the stockholders of the corporation at their annual meeting. Frankly, I don't know the niceties of a hospital, but I would imagine there's a similar parallel here. Administration being appointed by the board in turn being appointed by the corporators at the annual meeting. That board can be turned over periodically, I think with a staggered maturity. In any event, my question would be, what do the bylaws of the hospital specify in terms of procedure? That would be the first thing I'd go look at.
Thank you.
Thanks, Wheaton.
In the back.
Yes, sir.
Is there any indication that he is following the advice of the board and they hired him to piecemeal the hospital off and to sell it and he hasn't been able to?
We can only speculate what he's doing and why. And, we don't have transparency. The board meetings are confidential. A physician partner of mine and another individual by the name of John Wardle asked some of the difficult questions at board meetings and were asked to leave the board. So we don't know what's going on with the board. We don't know. But I'm a physician, not a businessman, but if all of your physicians leave, can you state we've reduced expenses to make us more attractive to suitors? We got rid of all the doctors. That doesn't sound logical to me. But if there's a method to the madness, it's beyond me. So we don't know what the board is thinking. The lack of transparency has precluded that.
Hi, everyone. I'm Representative Carol Hagan McEntee. I represent half of Narragansett and part of South Kingstown. And I'm here to tell you, each and every one of you has a state rep and a state senator. You should be reaching out to them. I keep hearing the Attorney General, the governor, the way you're going to get through to them, send that too, but get to your state rep, get to your state senator, tell them the problems we're having. We got the letters from the doctors. We also got the response from the hospital. So it's time, if we're going to, every year the hospitals look for money from the General Assembly, every single year. And if there's a problem with the community and the hospital, which we know there is, that's the way to get everyone to listen. So send your letters. The emails are online. You can look up the General Assembly website. You'll find who your state rep is, and well, you should know who they are, your state rep and your senator, but if you don't, you can find that on the Secretary of State. And then you go to the General Assembly website and you can find their emails. And I would say that is a very good way to start. But thank you for the 2 minutes. I don't mean to bust into your meeting, but I did want to hear what you had to say today.
We appreciate you
So
coming.
thank you, Doctor.
We appreciate you coming very much. Thank you. I don't see any more questions, I want to have a few closing remarks. Again, we'd like to thank you all for attending, especially the speakers who took time out of their busy schedules to share their stories. You've heard from individuals who've had life-altering or life-threatening conditions whose health has been impacted by management decisions. The fear of the quality that we've become accustomed to is deteriorating, and how the care may not be replicated in the future or even now compared to the care they received a few years ago. And there are many, many other patients much like them. Just, time limits us to a few speakers, but their stories are not unique. The hospital community deserves leadership that fosters openness and collaborative dialogue, rather than one that embraces an atmosphere of intimidation and fear. That's what we have now. The solution remains clear to many in this community, and that is the replacement of executive leadership. Chief Executive Officer Aaron Robinson, Chief Medical Officer Dr. Keven Charpentier, and Chair of the Board of Trustees, Joseph Matthews. So I think we should all appeal to our representatives, and we ask, again, all of them to help us, the Governor, Attorney General. I don't really care where our help comes from, but I just think this community deserves help. Thank you all.